against influenza, hepatitis A and yellow fever, which covers the large base of health concerns with respect to travel to Rio. The Zika virus situation, as you have been made aware of, is not a disease condition that currently has a vaccine prevention program. The vaccines are still to be designed and devised by the World Health Authorities, and therefore we are guided in our advice, in our implementation of a prevention program by those guidelines that are laid down currently by the World Health Organization, which have been adopted by the International Olympic Committee for these games, and by the very valuable advice that our own Ministry of Health and Child Welfare have also put down, which are consistent with all of those guidelines. So what we have been working on in the last couple of weeks as Team Zimbabwe has been finalizing and preparing is that we have devised a bulletin on Zika prevention for the team when we travel to Rio, which incorporates all the aspects that have been outlined. Most notably, we are making sure the team is fully aware of the Zika situation and its relevance to them personally, as individuals and as athletes, and also from the public health perspective that we have as Zimbabweans returning to Zimbabwe. So awareness is very important, and the team have all received one bulletin in this particular respect and are about to receive an updated bulletin this week prior to the initial parts of the team contingent departing for Rio. We will obviously in Rio be reinforcing the information situation so that we ensure that all the team are fully in the loop as far as the information that they need to have. We have made them aware that the most effective way to not contract the Zika virus is to prevent being bitten by the relevant mosquitoes that they have there in Rio, and which we do not have too many of here in this country.